Welcome to the deep dive. Today we're getting into a really common topic for revision, the prolapsed disc. You might also know it as a herniated disc or slipped disc.
Yeah, it comes up a lot. We've gone through the notes to pull out the absolute must-knows for you.
So let's start right at the beginning. What exactly is it?
Okay, so picture the discs between your vertebrae, like little cushions.
Yeah.
A prolapsed disc is basically when the gooey center part, the nucleus pulposus, pushes out through the tougher outer layer.
Like jelly squeezing out of a donut.
Exactly like that. And the problem is that squeezed out bit can then press on the spinal nerves right next to it.
Ah, okay. So the core definition is that displacement of the nucleus pulposus, and the key consequence is that pressure on the nerves causing symptoms.
Precisely. That nerve compression is central.
So what leads to this happening? What are the causes, the etiology?
Well, there are a few usual suspects. Age is a big one. Discs just degenerate over time. They lose water content, become less flexible.
Makes sense.
Then there's repetitive strain. Think jobs with lots of lifting or bending or even certain sports.
Right.
Spinal injuries, obviously. Maybe a fall or an accident. Improper lifting technique is another classic.
Yeah, lifting with your back.
Exactly. And then there are factors like obesity, which puts extra load on the spine, and smoking, which seems to affect disc nutrition. Genetics can play a part too.
Okay, quite a few things. We actually have a little memory aid for this one, don't we? AS-RIGOS.
Yes, as-RIGOS. So age, strain, repetitive, injury, genetic, obesity, smoking, it helps keep them straight.
Definitely useful for recall. Now, how does that relate to the risk factors? Who's most likely to get one?
Well, they overlap a lot with the causes, as you'd expect. Age is key. Again, it's most common between, say, 30 and 50.
Okay.
People doing heavy lifting or lots of repetitive movements, as we said. But also, funnily enough, a very sedentary lifestyle isn't great either. Weak core muscles don't support the spine well.
Right, sort of use it or lose it stability-wise.
Kind of. Then obesity, smoking, family history, those increase your susceptibility too.
Got it. So can we dig into the pathophysiology a bit? What's the actual mechanism?
Sure. So that outer layer, the annulus fibrosus, it gets weakened or maybe develops small tears. This could be from that gradual age-related wear or a specific injury.
And that lets the inside bit escape.
Exactly. The gel-like nucleus pulposus can then bulge out or herniate through that weakened spot. And the crunch point is where that protruding material physically presses on a spinal nerve root.
Causing the pain and inflammation.
Yeah, you get mechanical compression and often an inflammatory chemical reaction around the nerve root as well. That combo causes the pain, the numbness, the tingling, all those symptoms.
It sounds quite distinct, but I guess other things could feel similar. What about differential diagnoses?
Oh, absolutely. You also have to consider other possibilities. Things like more general degenerative disc disease, spinal stenosis where the actual spinal canal narrows, sciatica, that might be caused by something else, like piriformis syndrome. Even simple muscle strains can sometimes mimic the back pain component. And, much rarer, but you have to think about spinal tumors or infections.
Right. Keep the possibilities broad initially. How common actually is a symptomatic prolapsed disc, epidemiology-wise?
It's actually tricky to get exact numbers. You see, studies using MRI scans show disc bulges or protrusions in maybe up to 30% of adults.
Wow, that many?
Yeah, but many of those people have absolutely no symptoms at all. So just seeing it on a scan doesn't automatically mean it's the cause of someone's back pain.
That's a really important point. So what are the clinical features we look for when it is causing symptoms?
Typically, you'll get pain. It might be localized to the back or neck, depending on which disc it is. Lumbar is most common. Or, very characteristically, the pain radiates.
Like down the leg, sciatica?
Exactly. Sciatica is a classic sign of a lumbar prolapsed disc irritating the sciatic nerve. If it's a cervical disc, the pain might go down the arm.
And besides pain?
Nerve stuff. So numbness, tingling paresthesia, or muscle weakness in the area supplied by that compressed nerve. You might also find altered reflexes on examination.
And it varies a lot depending on the specific nerve. Yeah.
Hugely. L5S1 disc might affect your ankle movement, whereas a C5-C6 disc could affect your biceps or wrist extension.
Okay. If someone presents like this, how do we confirm the diagnosis? What investigations?
Imaging is key. MRI is generally the gold standard because it shows the soft tissues, the disc, the nerves really clearly. You can see the protrusion and if it's compressing a nerve.
What about CT?
CT scans can also be useful, especially for looking at the bone structure. but MRI gives better detail of the nerves and disc itself. Sometimes a CT myelogram is used.
And tests for nerve function?
Yeah, if there's significant weakness or uncertainty, nerve conduction studies and electromyography, or EMG, can help assess how badly the nerve is functioning or if there's damage.
Right. So once you've got the diagnosis, what's the plan? How do we manage it?
The main goals are, relieve the pain, calm down any inflammation, and get function back. Most people actually get better with conservative treatment.
What does that involve?
Things like relative rest, initially, not strict bed rest, but avoiding aggravating activities. Physical therapy is crucial exercises to strengthen core muscles, improve flexibility, and posture.
Pain relief too, I assume.
Oh yeah. Pain medications like NSAIDs or other analgesics. Sometimes muscle relaxants, hot or cold packs can help some people. And epidural steroid injections can be very effective for calming down nerve inflammation and pain.
Okay, that sounds like the first line. What if that doesn't work? Or if the nerve compression is really severe?
Then surgery becomes an option. The most common procedures are discectomy or microdiscectomy,
which basically means
removing the bit of disc material that's pressing on the nerve. Microdiscectomy uses smaller incisions and magnification, usually allowing quicker recovery.
And what's the outlook usually, the prognosis?
Generally, it's pretty favorable. Most people, maybe 80–90%, improve significantly with conservative management over weeks or months. Surgery also has good success rates for relieving nerve compression symptoms.
But can it come back?
Yes, recurrence is possible, especially if the underlying risk factors, like poor posture or lifting habits, aren't addressed.
Are there any really serious complications to watch out for?
They're rare, thankfully, but you can get persistent chronic pain. Permanent nerve damage is possible if the compression is severe or prolonged, leading to lasting weakness or numbness.
And the really serious one?
Very rarely, a large central disc prolapse can cause cauda equina syndrome, compressing the nerves at the very bottom of the spinal cord. So surgical emergency causes severe leg weakness, saddle anesthesia, and bowel or bladder dysfunction.
Okay, so important to catch things early and manage them properly.
Definitely. Early diagnosis and appropriate management are key to getting a good outcome and minimizing the risk of those complications.
So wrapping this up, the key takeaway is that a prolapsed disc is about that displaced nucleus pulposus compressing a nerve. Remembering the AS-RIGOS causes, the pathophysiology, the clinical signs like radiating pain and nerve symptoms, that's crucial revision.
Exactly right. Understanding why and how it happens helps solidify those features and management steps in your mind.
And here's something to think about after this. How much impact could simple lifestyle changes early on, like really focusing on posture, safe lifting, core strength from your 20s onwards, have on reducing the chances of developing these disc problems later in life?
It's a really interesting question, isn't it? Prevention versus cure.
Definitely food for thought. For more structured MSRA revision, do check out PassTheMSRA.com.
And you can find even more free resources and questions over at freemsra.com.